Thank you all for joining us today or tonight, depending on where you're calling from. My name is Chioma, and I'm the Community Engagement and Partnerships Coordinator for Livable Arlington. If you're not already familiar, I want to offer a few facts about fracking here in Tarrant County, Texas, to ground Dr. Epstein's presentation. Arlington is a city of about 400,000 people in an area of 99 square miles on top of the Barnett Shale, where fracking first began. We have about 400 gas wells extracting methane using hydraulic fracturing and about 50 drill sites, and the numbers are growing quite rapidly. The standard setback of 300 feet is measured from the wellhead to the main building of the protected use. That translates to gas wells right next door to daycares, homes, and medical offices. In Tarrant County, with a population of almost 2 million people, about half, or 1 million residents, live less than half a mile from oil and gas extraction. And that's the second highest number of residents impacted in any county in the United States. The Dallas-Fort Worth area has not met federal ozone ground level standards in 30 years, and emissions from the Barnett Shale greatly contribute to that. In terms of health effects on our youth, almost 1 in 4 children in Tarrant County have asthma. And Tarrant County has the highest rate of birth defects of any similar Texas county. Dr. Epstein's presentation is quite timely, given the major threat we are facing against Total's third attempt to drill in close proximity to 3 elementary schools and an early learning daycare center, all surrounded by what is a wonderful, vibrant residential community. Though the topic is dire, we hope that the presentation empowers you through knowledge to take action against fracking and other fossil fuel activities in your community. And now to introduce our resident expert, Dr. Ann Epstein. Dr. Epstein is a practicing physician specializing in internal medicine and sleep medicine in Lubbock, Texas. She is board certified in internal medicine and sleep medicine and is a fellow of the American College of Physicians. She also holds the title of Clinical Associate Professor of Internal Medicine, at Texas Tech University Health Sciences Center. Dr. Epstein has been chair of the Lubbock City Board of Health, chair of the Health Fracking Board Committee, and was appointed to the Lubbock Oil and Gas Citizen Advisory Committee. Since 2016, Dr. Epstein has written 2 review articles and co-authored a 3rd article on the health risks of fracking, which were published in scientific literature.
I'm going to talk about what we know so far about health effects from exposure to fracking, with a special concentration on what it's like to live in the midst of dense oil and gas development the way you are living in Arlington. Now, we know, first of all, that oil and gas development produces a number of air toxins. Along with methane, which is famously emitted from oil and gas development, there are a host of other chemicals that are dangerous to health. These are not separable from methane. Anytime methane is being emitted, these other things are being thrown into the air as well. These are the volatile organic compounds. That means things that evaporate quickly. And among them are the dangerous hazardous air pollutants. And I would like to talk about benzene, the most famous and most evil of all. It is a class 1 carcinogen because it clearly, without a doubt, causes leukemia. Sometimes you will hear questions about whether or not chemicals are really dangerous. There's no doubt about benzene. Benzene is really dangerous. It causes leukemia. It also acts on the chromosomes to suppress blood count production and causes life-threatening anemias and can suppress the immune system as well. And it has been linked to fetal abnormalities. Very high levels of exposure, such as to workers who open hatches and get sudden huge puffs of benzene. Very high exposures can be fatal. They can cause acute heart problems, seizures, fluid in the lungs, and death. There have been several fatalities of workers that have been directly exposed to a very high level of benzene. This isn't a problem for the general population. This is an acute worker problem. Children and developing fetuses are more vulnerable to all toxic air emissions than our adults. They're smaller, they breathe faster, they get a higher proportionate dose and more toxicity than adults. So benzene. Now let's look at benzene around oil and gas development. Benzene is a natural product of oil and gas. It's not just that it's injected into wells. As oil and gas come up from a well, it naturally comes up as well. Well, how much of a problem is this? I'd like to share with you an early report of benzene around wells. This is a scientist from the Dallas-Fort Worth area, Zachary Hildenbrand, published this in 2016. He drove around a bunch of wells with an electric car and sampled benzene. Why is an electric car important? Because automobiles produce benzene. So he had to have an electric car. I bet that was fun for him. And he drove around these areas in the Eagle Ford and sampled benzene levels. And what he found was that the average benzene levels in the areas in the drive around the well path was as much as 200 to 300 parts per billion. Now, down below in this lower section of the slide, you can see the toxic levels for acute exposure. Levels above 9 parts per billion over a 2-week period have been associated with major health effects. And the EPA thinks that benzene levels above 9 parts per billion are dangerous. And here we have benzene levels of 206 to 384 parts per billion. Very high, ridiculously high. And then he was able to pinpoint individual places where benzene was high, particular places. And he found especially flares, condensation tanks, and compressor units went up to 1,000 parts per billion. These benzene levels are acutely toxic. These are acutely dangerous to health. People, these guys needed to get out of there. This is dangerous. Now, the World Health Organization has declared that there is no safe level of benzene. The higher benzene levels you're exposed to, the greater your risk of cancer and adverse health effects. Nevertheless, our government has issued levels that are considered safe. And as you can see, here's what they are. We talked about the 9 parts per billion. For people with chronic exposure, that is probably people living in the gas patch in Arlington, levels of over 3 parts per billion are considered safe. But remember, there's really no safe level of benzene. There were a number of studies documenting elevated benzene levels. Now, it turns out that companies are supposed to report how much benzene is produced by an oil and gas well. And they do that. They report emissions standards. And what they've got is laboratory evaluations of the equipment, of how much benzene is leaked. They add them together and report that as an emission. However, when various people have measured emissions of benzene, what they discover was that the levels were much higher than expected, such as that study we just saw with Dr. Hildebrand and running around the well pads in the Eagle Ford. There was a big study using the first one in Colorado that demonstrated benzene levels in the air were 7 times greater than emissions that were reported. Well, finally, the US EPA got very serious about measuring benzene levels. And there have been a number of studies, but I'm giving you the ultimate one, which measured benzene levels here in the midst of the Wattenberg gas field that is in Colorado, there were 25,000 active wells in northwest of Denver in 2016. And this was a campaign with NASA. You can see this is the aircraft that was used, Discover A2 campaign. And this was by NASA. And what they did was continuous sampling. They flew spirals, 5 different air spirals, recording benzene in the atmosphere. Now remember, benzene is also found in automobiles. And so they had to try to distinguish between benzene that came from the oil and gas field and benzene from the automobile in the Colorado area. And here's what they found. This was, once again, a huge, expensive project. They found unexpectedly high benzene levels over the gas field. And the benzene levels from the gas field were greater than those produced by all the automobiles in the city of Denver. That's a huge amount. They did multiple fancy chemical analyses that found that the primary source of benzene was the oil and gas wells, not that it was washing over from the automobile traffic in Denver. They also found, so this is once again confirming the repeated studies showing that benzene levels were much higher than emissions report from oil and gas from the oil and gas operators. They found some other interesting factors as well. Benzene levels were significantly higher at night, with repeated peak exposures up to 29. Remember, I showed you that up to 9 was considered safe over a 2-week period, 30 for any hour. But these were levels of 29 at night. And let me show you the data here. Here is the data under blue. The red is carbon dioxide that they were measuring, but they also measured benzene. And if you look to the left-hand side, you can look at the levels. If you notice, there's continuous peaks of benzene. And there's one peaking at 29, right there on August 2nd. This was in 2014, I believe. And this was a peak at night. This is very important because the Colorado authorities have been relying on canister measures of benzene. And canister measures typically average over a long period of time and are only sampled during the day. What they discovered was that these measurements with continuous sampling, that they were frequently peaking to dangerous levels and were more prevalent at night when canisters typically weren't measured. So what we're seeing is more and more evidence that benzene levels are much higher than were reported and that anyone thought, and that the previous measurements were missing it. And these, by the way, are measurements on the airplane, well over ground level. At the ground where people in Arlington live, and where this group of people in Colorado live, of course, the level will be much greater because by the time it got to the airplane, it's already dissipated. So these are very high levels of benzene found predominantly at night and peaking, and that is being missed by various measurements. Finally, the Colorado Department of Public Health decided to take matters into its own hand and see whether these researchers were right. Well, of course they're right. But the Colorado Department of Public Health decided to look at this information. And what they did in a big project, and I have to give them a lot of credit for, is they went and dug a bunch of wells and measured 47 different chemicals at all sorts of sites, from starting at 500 feet all the way out to 2,000 feet. And this is very important because researchers before hadn't been able to measure benzene levels close to the well because the well operators wouldn't let them on property. And so this was very important. The Colorado Department of Public Health did this as an official government function. They dug a set of wells, they measured 47 different chemicals and found benzene levels. and then did calculations about health risks. And what they decided to do as a matter of policy, they ran multiple analyses, and they decided as a matter of policy that health would depend on the worst case scenario. So they were going to make rules based on the worst case scenario. And what they discovered was that the cancer risk from benzene, that they calculated from benzene, was in their worst case scenario, was elevated at all distances up to 2,000 feet. In other words, the cancer risk was above acceptable risk levels all the way out to 2,000 feet. For average risk levels, they thought it appeared to be only 1,200. But remember, the policymakers decided that they would look at cancer risks at the worst case scenario. Note, by the way, that this analysis would underestimate cancer risk because it didn't calculate the risk due to other air toxins that were listed as possibly or probably carcinogenic. That means causing cancer. Now, you should realize there are a lot of chemicals involved in oil and gas. 47 were measured. There are many more. Most chemicals have not had their cancer profile carefully measured. One of the factors in me talking about benzene is that it's a well-measured, well-characterized agent that has been the source of the major risks. But we think this was probably, and the authors of the article think that this is probably an underestimate. So this is cancer risks. Let's look at the non-cancer risks. One moment. Non-cancer risks, that is the illnesses that were potentially caused by benzene that were not cancer. And remember, they're measuring it at different distances from the well pad, which has to do with setbacks, which is will very much impact setback distances. At 500 feet from the well pad, where many people in Arlington live, 500 feet from the well pad, the risk due to blood toxicity from benzene was 10 times what is considered the acceptable level during the acute phase, and between 1 and 10 times elevated for benzene, toluene, and ethylbenzene. So these are other chemicals that come out along with benzene. They measured them. These aren't estimates. They measured the chemical levels, and they're estimating the risk. Now, out 2,000 feet from the well pad, which is well beyond any setbacks that are even considered in Arlington, but 2,000 feet from a well pad, there was a 10 times elevated risk from blood toxicity due to benzene, and between 1 and 10 elevated risk from blood and neurologic toxicity from benzene, toluene, and ethyltoluene. This is once again in the highest exposure categories. So based on these numbers, the Colorado Department of Public Health issued a rule that drillers establishing a presumption of 2,000-foot setbacks, that drillers who were requesting closer setbacks had to have their applications particularly examined. Now, I don't know what all that translated into, but the Colorado, based on direct measurements and good science, the Colorado Department of Public Health thinks that 2,000-foot setback is appropriate to protect public health. Now, when Colorado drilled those wells and measured them, those are what I like to say is well-behaved wells. These are wells without substantial leaks and without substantial problems. And those were average risk from a well-behaved well. But not all wells are well-behaved. So let me talk about wells behaving badly. These are super emitters. This was a study in 2016 was a helicopter-based study using infrared cameras. And you can see this picture, it's all in infrared. So the black is measurements of volatile organic compounds and gases coming off a well pad. They're not supposed to be that. It's supposed to be zero. It's supposed to be a still picture. What the researchers did was they mounted these FLIR cameras on a helicopter and surveyed well pads from the air. The operators were not real happy about all that, but they surveyed them from the air, and they managed to measure over 8,000 well pads in multiple different shales. So one question regulators often have is, well, this is a problem. Maybe this was a problem just in Eagle Ford, but surely it doesn't affect us here on the Barnett Shale. Well, of course it does. And so what the guys did, it was they set their cameras to detect only the highest level of emissions that would qualify as super emitters. And they found out that they quantitated how many super emitters are there per well pad. And you see the Bracken Shale has 13.8%. That's in North Dakota. They're having over 13% of their wells are super emitters. They're in Barnett Shale. It's pretty good as super emitters go. Only 3 to 4% of your wells are super emitters. And you can see some others. Marcellus is pretty good. The average number of super emitters is 4%, about 4%. What that means is that statistically, for you in Barnett Shale, between 3 and 4 of every 100 wells that you see around you are super emitters. They are not well-behaved wells. They are badly behaved wells that emit sometimes prodigious amounts of not only methane, but the toxic volatile organic compounds and hazardous air pollutants, such as benzene. And of course, it's all invisible to the naked eye. You have to use a FLIR camera to see it. They found out that the main emission sources were tanks, tank hatches, and tank vents, 92%. And what you can see in that illustration there is a leaking tank. And they were mostly random, unpredictable events. In other words, these are events that would have been totally missed in emission inventories that simply add up the components of well-behaved wells and find out how much they emit. These are accidents, fugitive emissions, unpredicted random events. But these things occur. Random events occur. They occur at least 4% of the time, and they profoundly affect the air we breathe in dense oil and gas development areas. And Zavala Ariza, in a companion article, in another article, found that the discrepancy between the inventory-based emissions reports, that is, the ones from the oil and gas companies, and the measurements that were being done in the air, such as in the NASA AQ study that I showed you, most of that discrepancy could be attributed to leaks, to leaky leaks. And most of those leaks came from tanks. You recall that in the NASA AQ study I showed you, there was this there were these spikes of 29 parts per billion. That was traced to a single leaky tank in the area that was being surveyed off in Colorado. So super emitters have a tremendously outsized contribution to the toxic emissions from oil and gas wells. Now, let's look at exposure issues. We've talked about, and I have hinted about, setbacks. How far can you set back a well before it's safe? And we talked about how the Colorado Department of Public Health thought that a 2,000-foot setback was appropriate. But suppose you have multiple wells. And we know this, you're having this problem in Arlington. You have lots and lots of wells. simply saying you need to be, say, whatever your well distance is, 1,200 feet, 1,000 feet back from a well, doesn't account for all the exposure that you have by multiple wells. And Ranjana, when you proposed this question to me, this sent me to the books about how to account for these wells or the multiple exposures that people in dense gas patches, such as in the Barnett Shale, are experiencing. And this is something that the researchers have been accounting for years. This is how to account for multiple exposures well. One of the methods, it's not enough to just count the wells or count how far, what the closest well is. This is a method, a statistical method called inverse distance weighting. It's a method for estimating your exposure to air pollution from multiple different sources, and it gives more weight to closer sources. As you can imagine, if your well is only 500 feet away, that like this appears to be at this well, which was, you're probably all familiar with this picture taken by Cami Carson. This is in Arlington. That should expose those kiddos on that playground to much more oil and gas than they would have been exposed to if it was 3 times the distance away. And of course, the more of them gives you more exposure. So inverse distance weighting attempts to account for this. And it's a fairly simple mathematical formula, and here's how it works. The inverse distance is 1 over the distance. So 1 over the distance from each well from a particular address. So you want to know what the exposure is to this daycare center. You measure the distance to the well and you divide it by 1. I'm sorry, you take 1 and divide it by the distance of the well, and you add up all the scores, and you get then a measure of exposure. So let me show you how it works. You have 3 wells at about 1 kilometer away. The distance is 1 kilometer, so it's 1 over 1 plus 1 over 1 plus 1 over 1, that's 3. The distance is, that score, that inverse distance well count score is 3. Suppose you have 2 wells at 1 kilometer and 1 well at 5 kilometers. That will give you an inverse distance weight of 2.2. Well, that makes sense. You've still got 3 wells, but one of them is farther away. So it's not going to expose you as much. And now here's another example. You have 3 wells and now they're only 0.5 kilometers away. Well, 1 divided by 0.5 is 2. And so you have 3 wells at 0.5 kilometers is 2 plus 2 plus 2 is 6. So if you look at those numbers, even though in each of these cases you've got 3 wells, the exposure factor is very different depending on how close you are and how many wells you have. So this is inverse distance weighting. And this is a key piece in a lot of the research that I'm going to show you. There's a variation of inverse distance weighting called inverse distance weighting squared, which actually is used most of the time. But this is a method to assess your exposure. And further studies about inverse distance weighting have shown that it actually is a pretty good, it looks like it portrays reality pretty well. It looks like it is quite accurate. So let's move on. What researchers often do is they're looking at a whole bunch of wells, a whole bunch of addresses, and they'll group them into groups, the high, medium, and low, or they'll group them into 4 groups and do research based on that. And now what I'm going to show you is research based on this inverse distance weighting, which accounts for multiple well exposures, such as you might have in Arlington. So now there are a huge number of fracking studies. As of 2022, there were 52 high-quality studies, of which 27 were the highest quality. And so it's no longer a matter of showing you, the 1 or 2 or 3 good studies. There are so many. What I've done is picked out for you the best of the studies that take into account well density. And here you see in this illustration, these homes are exposed to multiple wells. Okay, let's look at this particular study. This is by Lee. This came out in Nature 2022. This is a very important study. This is of older people, Medicare beneficiaries. It involved a huge number of people. That's a mark of a good study, a very large study population. 15 million people, looking at all major gas regions in the US. And they geocoded those addresses to 2.5 million oil and gas wells. And they calculated the inverse distance squared exposure. So they're looking at exposure levels that take into account number and proximity of wells. And they added another factor for downwind, because airflow, air direction, is downwind. And what they found is that mortality, that means the death rate increased progressively from low to high proximity. That is, the lower proximity group had an elevated death rate. The medium had an even higher death rate. The moderately elevated had a higher rate, and the highest had an even higher rate. They divided them into quartiles. So the greater your exposure quartile, the higher your risk of death. And in the highest level of exposure, there was a 2.5% higher risk of death. That's, considering the number and that we're dealing with death, it's actually a lot. That's quite a lot of people. And then they added, that was before they added the wind direction component. When they added the wind direction component, the risk, if you were downwind and in the highest quartile of exposure, your risk was 3.1%, significantly higher. And since it was correlated with wind direction, this suggests that the driver of this mortality is air pollution. Very important study. Published in Nature Energy, a very important scientific journal. Now let's look at a study of asthma. This was asthma attacks in the Marcellus Shale that is in the Pennsylvania area. And they looked at 35,000 patients. These are children and adults with asthma attacks, and they divided them, and 35,000 patients with asthma attacks, and compared them to patients with asthma who didn't have attacks. So that's a very good control group. And they correlated that with well density, inverse distance squared well density. And they divided it into quartiles, into 4 phases. And their results were that asthma patients exposed to the highest level of well activity had between 1.5 to 4.4 times greater odds of getting an asthma attack than asthma patients who were not exposed to that well activity. And they had a fancy metric that involved 12 measures. It was significant for 11 out of the 12 measures. This is a very good study. And they found increasing odds of an attack with increasing exposure levels in over half the metrics. This was published in JAMA. This was published in one of the biggest of the medical journals, Internal Medicine, in 2016. This is very good data. And I understand that in Arlington you have, and you were telling us, Chioma, about the asthma attack level in Arlington. Once again, this is a factor of exposure. The higher your exposure as inverse distance weighting, the higher your exposure, the greater a chance of an attack. Here's one that was also published in the Journal of American College of Cardiology, big, important medical journal. The question was, they looked at people with heart failure, people predominantly elderly people who already have a disease called congestive heart failure. And the question was, if you already have congestive heart failure and you're exposed to gas development, unconventional natural gas development, does exposure make your heart failure worse? That was the question. They looked at, worse, bad enough to be hospitalized. So they're looking at hospitalizations for worsening congestive heart failure. And they looked in Pennsylvania at almost 6,000 patients and compared them with controls, people with heart failure who are not hospitalized. And once again, they looked at this at exposure levels with inverse distance weighting of exposure to calculate who was the most exposed. And what they found was that the odds of hospitalization for heart failure were increased in the highest quarter compared to the lowest quarter of density exposure. And they divided them into different phases of drilling and production. And they found over 60% for all of them, but higher for the well pad prep phase and the stimulation, the fracking phase, but no increase for the drilling phase. So these are attempting to find out which are the most toxic portions of oil and gas development. But as you can see, the numbers are very high for people in the highest level of exposure. And those were not, they were higher than the lowest level of exposure. Okay, we talked about benzene and cancer. This is childhood cancer. And this was McKenzie in 2017. McKenzie is one of the leading, earliest, and best of the publishers in health effects. And she's doing her research in Colorado. And she's looking at cancers in rural Colorado. It has to be rural because people in the cities are exposed to large amounts of industrial chemicals. So she's trying to control for that by looking at rural kids in rural areas. Of course, the fracking there's a lot of fracking in rural areas. And she was able to identify actually only 87 kids with the most common type of cancer, ALL, which is acute lymphocytic leukemia, and some with lymphoma. And she used controls of cancers that were not bloodborne cancers. So this looks at a lot of the toxicity potentially from benzene. And once again, she used inverse distance weighting, as we discussed, to compare it to judge exposure to oil and gas wells. And what she found was that children ages 5 to 24 with this particular type of leukemia were 4 times more likely to live in the highest tertile of well density compared to controls. So the inverse distance weighting group were divided into 3, high, medium, and low. The highest density contributed a 4 times risk of developing leukemia. And the risk increased with each tertile. That means that very much strengthens the claim that it was due to the oil and gas, that it was clearly associated with the oil and gas activity. And so it was increased with each tertile. So this is a condition that appears to be very much associated with well density, once again, using the inverse distance weighting. ALL is the most common of the childhood cancers. You will be pleased to know that the current 5-year survival rate is over 85%. Still, nobody wants this. Now let's look at heart disease, congenital heart disease. This is once again Professor McKenzie in 2019 looking at births in Colorado. You should know that congenital heart disease is among the most important of the congenital defects that children are born with. We're looking at major congenital heart disease in this study. Major congenital heart disease, which is a number of trips to the cardiac surgeon specialists who operate on babies in multiple stages in infancy and through childhood. This is not a little thing. These children require surgery to grow into adulthood and may continue to have problems all their lives. This is fairly common. I personally know two people. This is outside of my practice, two people whose children had congenital heart defects. So this is not a rare problem. So Professor McKenzie identified 469 cases in Colorado. This is probably in rural Colorado, and matched them with controls. This is a nested case control study. That's a very good quality study. And once again, compared this to the intensity of oil and gas exposure, which is inverse distance squared measurement of exposure, and divided the groups into high, medium, and low exposure levels. And what she found was this is major congenital heart disease, was 40% more likely in mothers who had been exposed to medium oil and gas intensity. That is the medium quartile in the inverse distance squared exposure, and 70% higher in mothers exposed to the highest intensity of oil and gas development. And the control was people 10 miles away. That's often used as a control. We think that 10 miles is away from an oil and gas well pretty well makes it clear that that's not the problem. All right, so another one, congenital heart disease, clearly associated with well exposure. All right. Moving on, there is more. Here is a study done in the Barnett Shale in 2008, well published in Environmental Health Perspective by Christina Walker Whitworth. It looked at 160,000 births in the Barnett Shale over just a 2-year period, and used inverse distance squared weighting to estimate well exposure within 0.5 miles. 0.5 miles is a little over 2,500 feet. Is that correct? I don't quite see the math here, I haven't done the math personally, but it's a little over 2,500 feet. It's well beyond the setbacks that are already established in Arlington. So they accounted for well exposure, inverse distance squared weighting, and they divided them into drilling and production activity, once again trying to get straight on which were the most dangerous phases of oil and gas development. But what they found was mothers who were exposed to the highest level of drilling activity in pregnancy had a 20% increased risk of preterm birth, that's less than 37 weeks, and a 2x, that's 100% increased risk, that's 2x the risk of extremely preterm birth, which is less than 28 weeks. Though those babies have a tough time. I mean, 37 weeks will increase the increase diseases, increase cost of care, put those babies at risk. 28 weeks, babies are starting to have very high mortality rates. That is a very serious pregnancy contribution. Exposure, on the other hand, to highest level of production activity gave a lesser increase of preterm birth, 15% higher risk of preterm birth, and 53% higher risk of extremely preterm birth. And there did seem to be a greater risk of preterm birth if the babies were exposed during the first and second trimester. And this would make sense. These are times when early fetal development, when there's a great deal of development going on in early fetal development. And this was right there in the Barnett Shale. Here's another one from Southwest Pennsylvania. This is an older study, 2015, still a very good study, looking at 15,000 birth records in 2007 to 2010, comparing them to 500 active wells. I mean, we can almost chuckle at that. That seems like such a small number these days. And they're estimating exposure to wells within 10 kilometers. That's a pretty far distance. So even with a relative, and they did this with inverse distance weighting exposure. as we discussed. And what they found with even these, what we'd call relatively light exposure levels, infants in the highest quartile of exposure were 34% more likely to have low birth weight below the 10th percentile compared to infants in the lowest quartile. And if you'll notice, the lowest quartile was less than 0.87 wells per mile. So these guys are dealing with a much lower level of well density than you have in Arlington. They found no increase in premature birth, but on the other hand, it was not a very dense level of exposure. And here's one that just came out in environmental research in 2021. This is from the Texas Birth Defects Registry in Texas. Almost 53,000 children, infants with birth defects. Texas keeps a very good registry of birth defects. And so it's not just 53,000 children, it's 53,000 children with birth defects. And so this very large number increases the quality of the study. And they compared those kids with children born at the same time without birth defects. And they did exposure to wells as well. Now, this study did not use inverse distance weighting. They just used different distances, 1, 3, and 7.5 kilometers away. And they did number of wells per kilometer within each buffer. So this is not inverse distance weighting. It is a rougher version. I would have liked them to do inverse distance weighting, but they did not. And they found that the highest density of exposure at the 1 kilometer radius, much further away than your setbacks. At the highest density of 1 kilometer, they had a higher odds ratio of the birth defect, which is anencephaly and spina bifida. Now, you guys may be familiar with spina bifida. It's not that rare. It can cause neurologic problems in the legs in babies. Varies in severity. Anencephaly is similar developmentally to spina bifida, except instead of the spine being open at the bottom, where the tailbone is, the spine is open, the spinal cord is open at the top, which is where the brain is. And so basically these children are born without brain, not survivable. So they found a higher density, a higher risk of anencephaly and spina bifida at 1 kilometer. And the second and third density at all distances showed higher odds ratio of heart defects. So let me just summarize. Once again, I have selected for this presentation, I've selected those studies that look specifically at well density and their well density's contribution to health effects. And here is the summary. For people who are exposed to high well density, these people have a greater chance of experiencing death in the elderly, asthma attacks, heart failure hospitalizations, childhood leukemia, birth defects, especially heart defects, preterm birth, babies born too early, and low birth weight. And on that demoralizing note, I will end the presentation.
Thank you so much. We have been taking note of some of the questions that have been submitted during the presentation, and then also looking at some questions that you all submitted upon registering for the call. And so Dr. Epstein, if you're open to it, I'm going to throw a few your way. Some of the questions for those of you who did submit, we may be able to provide resources on later, but I'm going to focus on those that are within Dr. Epstein's area of expertise. So the first question was about over time, right? So many people are living at these sites, not just for 1 year or 2 years, but for a lifetime. So the question was, can the health impacts from fracking worsen over time, even if the fracking site remains the same? And what are the risks associated with drilling new wells on old well pads?
It depends on the nature of the harm. I mean, if this was a congenital heart disease, for example, and a pregnancy-related problem, then clearly, the harm is done. And it's not an issue of continued harm. If it's an issue of, for example, asthma attack, then when you move out of the asthma area, well, so for example, people with asthma attacks go on vacation away from wells and their breathing gets better. And they come back and it's worse. So I don't think it's cumulative. That sort of thing is cumulative. It's just ongoing. It will go on and on as you continue. In terms of some of the hematologic toxicity that you get from benzene, for example, the not just leukemia, the leukemia, this may not be a congenital defect. It may be acquired by kids in early childhood. And things like aplastic anemia, those, I'm not sure those will go away. Those may be chromosomal abnormalities that are induced. And so things that are chromosomal abnormalities it's not, maybe they were cumulative for a period of time and then you stop and those things probably won't go away. Things like heart failure, that is probably due to local effects of pollutants on the airways, makes them more unstable. That will probably go away when you take your vacation away from the Barnett Shale. But some of those factors may be long lasting.
Thank you. And then I imagine their question about new wells in an old well site, that's just going to impact the inverse.
That will just impact the inverse square. I mean, now there have been issues. Some people refrac a well. Some drillers will refrac a well. And there's issues because we're dealing with the same with the same drill hole. There's issues about wear and tear on the actual well itself, on the lining, on the cement, and whether or not it might be more likely to cause problems. But that would probably be more for water than air issues. So I think the well pad itself is probably not particularly relevant, as long as it doesn't intersect the well that's already been drilled. The wellers are very good. The drillers are very good at that. So no, I don't think it just impacts proximity and number.
Thank you.
Now, of course, I should mention about the proximity number. If you have a well pad, if you would like to, go back and start calculating your inverse distance weighted exposures, remember that every well counts as one. So if you have a multi-well pad with 8 wells on it, that's 8. That's not 1. So each well, it counts. Each well counts as 1.
Yeah, and we have a drill site in Arlington that's approaching, I think, 20 wells on one pad. So yeah.
I mean, you can see it's efficient. It has this advantage is it doesn't tear up the environment as much, although of course the well pad is bigger. But each time you drill into the ground and extract this stuff, it's the stuff that you bring up. That's what causes the problem. It's not the area that you drill it in. So every well is independent. It should be independently counted.
Someone asked about fracking fluid and radioactivity, and I'm not sure if you've had any look at research in that field. I know there's a few articles that can be shared, but
I was able to review one article that's tenorm, which is a naturally occurring radiation. This is natural. It's not put in by the drillers. It is associated with oil and gas development. It tends to ride on the particles. So the problem is the oil and the radioactivity can be found on the small particles, which are then distributed as part of air pollution. And I was able to look at some of that. Those particles, they've been found up to 10, 20, 50 kilometers out. Although the toxicity, the markedly elevated levels are probably found out to 10. Let me just see, I think I made a note on this. Probably out to 10 kilometers. And yes, they have been associated with elevated levels of radioactivity that are enough to confer health risks.
Thank you for sharing. That kind of ties into another question someone had, and you addressed it when you talked about inverse distance weighted, but I think they're trying to get more at how far can this pollution actually travel? We've talked about setbacks, but of course it's going to go beyond that. Is there any research on how far out it's going? Obviously it's going to diminish as it goes out, but.
Right. Well, yes. I mean, the basic pattern is you have a single well admitting a source, and then as the pollution gets further and further away, it gets progressively more and more diluted by the air. I did find one study from Fort Worth that showed detectable air pollution of a particular marker out to 2 miles. Now, that doesn't tell you the whole story, because remember, for almost everything, there's, if it's diluted enough, it's not going to be that big a health risk. So the question is, at what point does it reach dilution levels that are reasonably safe or don't constitute an excessive risk? And this was the question that the Colorado Department of Public Health tried to answer with its drilling. And it found high health impacts out to 2,000 feet. Now, of course, that's just one well. Each one of those were just one well and no super emitters. So the answer to how far do pollutants spread on the ground? It's probably detectable at least 2 miles. And up in the air, once things become airborne, the researchers who flew the NASA AQ planes found benzene mixing up to 5 kilometers. That's as high as they went. It waxes and wanes with the nature of the atmosphere and the weather. So it's widely dispersed. However, the risk levels, I mean, you're never going to get to zero, or by the time you get to zero, you'll probably have other air pollutants, such as from automobiles, gas stations, urban living. So you want to look at health effects at particular distances.
Thank you. That's super helpful. Following up on the Colorado Public Health Study, people had questions about what did that look like when they were looking at residents? Did they just test the blood of nearby residents? How did they collect that data?
They didn't test the residents. What they did is they put out markers at 500, 1,000, 1,500, 2,000 feet, and they measured benzene levels at those markers. That's the only measurement. The rest of that was modeling studies based on health effects that could be anticipated with when you have pollution levels of the amount they measured. So that was all calculated. They didn't measure it in people. It's very hard to measure benzene levels in a person. It's fairly rapidly metabolized and leaves the system. So you could get benzene measurements, but the testing isn't very good and it washes out quickly. There have been very few cases where somebody actually got a blood benzene level. Now, there was a study in Canada looking at indoor benzene levels in exposed pregnant women. And that sort of things have been done, looking at, the Colorado study was all outdoors, but you can look at indoor air pollution, and that's done for a number of other reasons as well. But no, the Colorado study measured benzene levels and calculated, but did not measure risks.
Okay, that's super helpful. wondering if you could talk a little bit about noise. So here in Arlington, a big focus of residents' area of concern has been noise from drilling nearby. We have homes, as little as 300 feet away from wells that are being actively drilled. So is there anything you can share about how loud noise that's going on for a long period of time can impact health?
Well, we know that noise, of course, is very annoying. I mean, and you may not think that's serious, but it is. People, the level of I wouldn't discount general irritability as a lifestyle problem. But regarding the health effects, exposure to noise levels has been shown to impact learning and cognitive levels in children, impairs learning and impairs children's cognition. And it also interrupts sleep and worsens cardiovascular disease and high blood pressure. So this is not trivial.
Absolutely. Game for a few more questions here?
Sure.
Wonderful, thank you. You play a very prominent role in the medical community, and someone who's in Pittsburgh actually asked this about how can they get medical communities and health systems. It sounds like in Pittsburgh, it's Hugh Health is their main one. But we have Texas Health here, we have all these others. How can we get them to speak out on fracking, or maybe that already is happening, we're just not aware?
Well, one of my colleagues, Marcia Haley, is in Pittsburgh. And she was the lead author in an article on setbacks that I was very fortunate to contribute to. And she has spoken out widely about the effects of setbacks in oil and gas. And there have been conferences in Pennsylvania. So it may not be that people aren't talking about it. They are. It's a question of impact. Perhaps it's a question of impact. So now I'm speculating here. I mean, I know that there have been talks in Pennsylvania. I did attend a talk in Pennsylvania as a panelist that was looking at the ethane cracker that was being developed outside of Pittsburgh, a huge facility, and prompted a number of concerns. There were concerns in Pennsylvania about what looked like it might be a cancer cluster. A large number of people attended that. So I will now speculate, when doctors and professionals speak out, political action doesn't immediately follow. There are many steps between spreading knowledge and translating that knowledge into action that protects public health. In Lubbock, when I was on the board of health, the reason I got into fracking was that I was a member of the board of health, and there was a community activist, and the community activist made a presentation to the board of health and said, we've been trying to get the attention of our city council about fracking. Would you guys help us? And I had just seen an article in Science News about fracking. I said, okay, I'll look it up. I'll present it at the next meeting. Well, it was naturally much, much more complicated than I could ever imagine. And that's what started me on my interest in fracking. But once again, it was a community health member coming to a recognized board of the city council. And then we went on to present information to our city council through another committee as well. And we actually made progress, which was then canceled by the Texas legislature 2 weeks later. So there are many steps between here and there.
Yeah, absolutely. That actually ties into one of these last questions I have for you. Someone said, well, why isn't the government doing more monitoring? Well, you mentioned a key thing there, the Texas legislature, but I wonder if you have more to share about that.
You guys know more about this, than I do. But I've certainly done and heard of many presentations to Texas legislators who's about the health effects, and there were all these complaints. Oh, there was something wrong with the study, or more commonly, there's something wrong with you, the researcher. We're going to insult you. The studies are bad. Oh, it's just university studies. With all these studies that I've only given you a piece, the ones that looked at inverse distance weighting. With all these studies, the issue that, oh, it's never been shown. Yeah, that's not it. So we have a resistant legislature. And these problems are deeply entrenched. There is movement. For example, the EPA just recently finalized, under President Obama, finalized new source performance standards that require methane capture and monitoring. But on top of, for every step forward made at the legislative level, there are problems with enforcement, measurement, monitoring. We make small steps forward, but requirements, we ask for requirements for monitoring, for fence line monitoring for benzene. There's a little bit of progress, and then we discovered that it was never enforced and no one measured. And when they measured the benzene levels and the benzene levels were high, nobody enforced anything. So this has, I will summarize these things under the general heading of lack of political will.
Yeah.
And so how do you change political will? Well, we have experience with this. I think it extends beyond just oil and gas monitoring. It extends to the willingness or the demand that the public shows that our elected representatives take account of public health.
Absolutely. Last question. Do you know of any studies currently being done that you're excited about, or looking forward to seeing what the results show?
Oh, I wouldn't be in the loop to know what's currently happening, but there's just all sorts of studies about health effects that are coming up that are very exciting. I mean, there's a very large number just between the time of the review article that I showed in 2022 and current 2024, health effects studies keep piling up. And these are increasingly being published in the medical literature, and legislature, I think, has a harder time ignoring medical literature. That doesn't mean they won't do it. It's just a little harder. But the studies continue. Once again, the magnitude and the number of studies are so great that the claim that, well, nobody's proven that fracking is dangerous, I think that is no longer tenable. But what I would like to see happening is I would like to see concentration on the super emitters. Super emitters emit a huge percentage, depending on what you define as a super emitter. They're emitting 50% or more of the dangerous emissions, not even counting the methane. If we can concentrate on monitoring and handling, on reducing the emissions from super emitters, that would be a great place to put activism and activity. But we already know a great deal about super emitters. So this stuff is known.
Yeah, absolutely. On that note, I will share to everyone in the group a great resource if you are interested in looking at studies. One, I believe we'll be sharing out the slides from Dr. Epstein. I believe we did that the last time. And then there is also a compendium of articles that's updated annually. It's the 9th compendium right now, and I imagine this fall might be the 10th. But that is also a great resource. And then in my role as social media coordinator here at Lubbock, I can tell you our social media, our newsletter is always a great place when we hear about something new that's come out and been published. We try to alert y'all to those impacts. But without further ado, I'm going to pass it over to Ranjana, who's going to close us out.
Thanks, Jennifer. Hello, everyone. Thank you so much, Dr. Epstein, for a very informative presentation, as always. You've been a great friend of our organization since the very beginning, almost 10 years ago. And we are grateful to you for having provided us with the medical research and the scientific research to ground our advocacy since Livable began. Your published research, presentation, and guidance were extremely helpful in persuading our past council and our past mayor to not just deny some gas well permits, but also to pass new rules to strengthen our ordinance. And I really appreciate your educating us again about well density, because this is becoming a crisis in Arlington as French energy company Total keeps adding more and more new gas wells to their existing sites here. And they're even thinking of creating a brand new site with 10 new wells. I know and I hope that this presentation will help all of us here be better advocates in our communities and for our communities and our families. I want to give a special shout out to the attendees. I know some of you are attending from places far away in Pennsylvania and all the way in South Africa. I appreciate the breadth and depth of our movement for justice for all our children, but this is also a sobering reminder of how global the threat from fossil fuel extraction is. Thanks to everyone who's attended today. Please stay in touch with us by signing up for our emails and for our newsletter. And those of you closer to home, there's also a link in chat to add your name to our volunteer list. And sometimes volunteering can be as simple as showing up to something or alerting us about something that's happening in your neighborhood. And we appreciate everybody pitching in, because in the end, our goal has always been to create a people-powered movement that can push the levers of power to make change based on sound science to protect our communities. I also want to say, introduce everybody to Chioma Ugunali, who's our brand new community engagement and partnerships coordinator, who had a lot to do with organizing this event. We're delighted to have her, and those of you who are in Arlington will see her around town at future events and engagements. And thanks, as always, to Jennifer, who brings you all our great social media content and did such a great job of organizing, running our webinar today. I think we've dropped something in chat with a petition against the new drill site that is planned. And thanks again to everybody from all of us at Livable. It's great to see you all here today. So, thanks.
All right, everyone. We're going to formally close the call. Thank you all so much.